Good afternoon, everyone. We call the meeting to order. Welcome to the Board of County Commissioners, July 28th, 2020 business meeting. Would you all stand and please join us in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Mr. Ingalls, do we have certification of our agenda today?
We do, Mr. Chair. My office has reviewed all items on today's agenda, and they all meet legal approval.
Thank you, sir. And is there any disclosures for any commissioner for any item on our agenda today?
I have none, Mr. Chair. Thank you.
And I have none, Mr. Chair. Thanks.
And I have none. Thank you, everyone. At this time, we'll ask for if there's anyone in the audience for any citizen or organizational comments. So if anyone would like to address the board, either in the room or virtually on the phone, this is a time for you to do so. We do ask if it's an item that is either on our consent agenda or our regular agenda, that we would wait until that time arises for that item. So at this time, is there anyone in the audience that would like to address the board? Seeing no one in the room. Ms. Dunning, is there any hands raised, or are you aware of anyone who would like to address the board?
Thank you, Mr. Chair. I see no hands raised.
Very well, thank you. At this time, we'll go to item number 3, our consent agenda. Is there anyone in the audience who would like to address the board regarding any item on our consent agenda, either in the room or virtually on the phone? Seeing no one in the room, is there anyone on the phone?
Commissioner, I see no hands raised.
Very well, thank you. We have items A through P on our consent agenda. I'll bring it to the board for any request for any item to be discussed or pulled and/or a motion.
Mr. Chair, I do have a question for the county attorney. Do you know if O and P have been resolved?
I have not received any information that they have been resolved and should be pulled off the agenda. I checked my email right before the meeting started.
Okay, thank you. With that information, I'm ready for a motion, Mr. Chair, if you are.
Please.
I have a motion to approve the requests in all items A through P of the consent agenda.
Second.
We have a motion and a second. No further discussion. All in favor state aye.
Aye.
Aye, the motion passes. I forgot to mention, the commissioners have lowered their masks so that we are able to be understood either here in the room or on the phone. Otherwise, we were wearing our masks. I just wanted to make that note. Now we move to our item number 4 of our regular agenda. The first item is a resolution adopting amendments to Chapter 5, Chapter 8, and Appendix D of the Roadway Design and Technical Criteria, Douglas County Roadway Design and Construction Standards Manual. Presenting for staff, Engineering Permits and Inspections and Utilities Manager, Dale Roberts.
Good afternoon, Commissioners. As you said, Daryl Roberts for Public Works Engineering staff. As you're aware, over the past several years, Douglas County Public Works Engineering staff has been working on revisions to Chapters 5, 8, and Appendix D. These 2 chapters haven't been revised since 1994, so with revisions in the construction industry, these amendments and changes are well overdue. Several years, or about a year ago or so, we had a public meeting. We also sent out surveys in reference to our proposed amendments. Through feedback, it was determined we needed more work to do on it, so we went back to the table and we checked that other government agencies were doing and so forth, and we incorporated some of their specifications into ours with some revisions, and I believe that helped us keep the process going till we got to today. The team was pretty dedicated, and I'd like to introduce the team members for the Public Works Engineering staff. The first one on the list would actually be Fred Cook. He's not here right now, but Fred was pretty instrumental in helping us understand why the specifications were written in the old manual the way they were, and then helping us modify those specifications and move forward to keep the intent of the inspection or the specification and give us a good product. The second member, and I'd like them to stand as I go through their names and stuff, would be Janet Herman, our current Director of Engineering. She made sure we stayed on track and provided some very pointed direction to ensure that we created specifications that were reasonable and yet provided that same product that Fred was always looking for to give us a good product that reduced maintenance costs down the road. The next person on the team was Pete George. He's the engineering inspection supervisor. As the head of the engineering inspectors, and he's also in charge of reviewing all pavement design submittals. His experience and understanding of the old and the new specifications was very much needed throughout the time spent updating these standards, and he did a great job for us. The next person would be Dan Roberts. Dan came in after some meetings with the construction industry and the testing firm. He was very helpful in inserting revisions that included modified specifications associated with the Metropolitan Government Pavement Engineers Council. It's MEGPEG for short. I believe that was pretty instrumental in getting the industry to buy into these revisions to our standards. The next person would be Eric West. He's the president of the West Test and our consulting engineer specializing in materials in asphalt binders. I've known Eric for quite some time. He and his staff were extremely professional and instrumental in helping us write our new specification. And then the final person would be Rebecca Barnes. No job's complete until the paperwork's done. Rebecca handled all of our revisions, all of our typing, all of the formatting and everything to get it to its current state of being. And she was outstanding, okay? There was a lot of revisions in the last 2 or 3 years, so. At this time, I'd like to introduce some people that don't always agree on what color of pavement to use. But they were very helpful in getting the task completed. They spent a lot of time reviewing our changes and providing suggestions and amendments. The first person I'd like to introduce is Tom Peterson. He's the Executive Director of the Colorado Asphalt Pavement Association. Okay. The next two are the members of the American Concrete Pavement Association. The first one would be Angela Folkstead. She's the Executive Director. And then the next one would be Sarah Sanders, who's our pavement engineer. These three people brought a lot of professionalism and expertise to the table in their review and comments and helped us quite a bit as well. So at this point, I'd actually like to open it up and let some of them make comments if they would. And then I'll come back once they're done, if that's okay.
Sure, and Daryl, since they were probably very instrumental in the document itself, I think that would be appropriate versus having them speak after the presentation. So I think that's appropriate. So whichever you would like to call it first. And Daryl, I think you appropriately put that. I like how you stated sometimes there's a difference in the color of pavement. That was very appropriately said. And
Good afternoon.
Ms. Folkstead, if you would mind stating your name and spelling of your last name.
Sure. Angela Folkstead, Folkestad, with the Colorado-Wyoming chapter of ACPA. And good afternoon, Commissioners. Thank you for having us here today. I want to just express our appreciation for being part of this process. I think the changes that we proposed, the discussion we had with all the engineering and public works staff will lead to higher quality pavements no matter what the color, as Daryl said. So we appreciate being part of that. Our industry has enjoyed a good relationship with Douglas County and all the inspectors, designers, everybody in the county that's involved in constructing pavements. So I think we've learned a lot over the last 25 years since the specs were last updated. And so we've tried to implement a lot of those changes in technology that have happened. And I think that will increase value for the county. Some of the changes that were proposed on the concrete paving side were reducing cement content. So that gives you a higher, I guess, a better economic value and also better quality. So that may be counterintuitive to what people have thought over the years, but that's the way we're progressing and moving towards the most durable mixes we can put out there. So I think we're increasing quality, increasing the economic benefits, and we look forward to continuing to work with all of you and with Public Works. So thank you again.
Thank you, Ms. Hochstead.
Thank you, Mr. Chairman, members of the commission. Tom Peterson, Peterson, Director of the Colorado Asphalt Pavement Association. We're the 9 million ton asphalt industry of Colorado. And I'll echo what Angela said. We appreciate the collaboration that staff did with industry. That's not required. That's not a given that an agency would reach across and work with the construction industry to ensure quality long-term pavement performance, but then make sure it's constructible, producible, economical, and environmentally sustainable. And so when you open your bids, no one wins if there's surprises on bid opening day. And so I think the new standards will update the requirements to state of the practice technology, best practices in construction requirements, and as well as industry advances. And so we fully support the resolution, the specifications, and we again thank staff for working diligently with industry. And often it's herding cats with all of the comments that come in from the various sectors of the industry, but we thank them and we support the resolution. Thank you.
Thank you, Mr. Peterson.
So I'd like to thank Tom and Angela again for their support throughout the years as we reach this point. At this time, I'd like to recommend approval of this resolution to amendments to Chapters 5 and 8 and Appendix D of the Douglas County Roadway Design and Construction Standard Manual. And I'd be willing to take questions if you have any.
Thank you, Mr. Roberts. Questions for staff?
I have none. I have comments, but no questions. Thank you, Daryl.
Same. Thank you, Daryl. Wonderful presentation.
Thank you, Daryl. So at this time, I will call for anyone in the public who would like to address the board regarding the roadway standards and design and technical criteria. So if there's anyone in the audience who would like to address the board, please feel free to come forward. And I will ask on the phone if there's anyone on the phone who would like to address the board.
Commissioner Partridge, this is Troy, your host. I see no hands raised.
Very well. And I see no one in the audience coming forward, so we'll close public comment and we'll bring it back for commissioner questions or comments.
Thank you, Commissioner Partridge. I would like to thank all the staff who had any part in doing this project. Last night, I went through all of the packet, and there were 143 pages as this one item. So that just gives everyone listening some idea of the breadth and the depth of this project. This is truly amazing. And is it Becca who did all the formatting and everything? Oh my gosh, I need to get your name and number. There were, I mean, the logo is straight. There are tables in here. There is mathematical equations. When I read through this, there is so much information in this packet. So I'd like to commend Fred and Janet for taking the leadership and everyone who worked on this project. And here's where this becomes important. I was out walking last week outside of the county, and I saw a horrible patch job. And I just am so used to the great roads and projects here in the county that I took a picture of that and I sent it to somebody in the room. And I said, I am so proud that I work in a county where something like this would never happen. And what makes this so real is that you all spent time putting 143 pages of how you take care of the roads and everything you check to make sure that it is quality here in Douglas County. And that's where it became so obvious to me about how much you care and what you do for the citizens of this county and the visitors here and the businesses. So thank you for all the work that everyone did on this incredible project. Thank you.
And I will just echo Commissioner Thomas's statements that this is an incredible endeavor. And when people come down to Douglas County, they always say, well, this is Mayberry. And one of the reasons for that is because good isn't good enough for most of you and certainly for us. You really take your work very seriously, and the level of quality and impact that you have in our community is noticed by not only our citizens, but by the visitors that come here. So thank you for this incredible work product.
Good. Thank you, Commissioners. I certainly agree. And I will just add to that, the industry experts, we really appreciate your work on this and your cooperation. Staff's done a phenomenal job all the way around. And I kind of actually enjoyed reading through that. A nerd I am. Huh? But it's very interesting for the public to wonder why it takes so long for a project to go to concept to come to ribbon cutting. And all they have to do is take a few minutes and look at this document, and they realize the depth and the detail that it takes to be able to provide a quality product for them to be the traveling public on. So thank you so much for everyone for all you did. Staff and experts, we really appreciate it. This time, I'll entertain a motion.
Mr. Chair, I'll make a motion to approve a resolution adopting amendments to Chapter 5, Chapter 8, and Appendix D of the Roadway Design and Technical Criteria, Douglas County Roadway Design and Construction Standards Manual.
Second.
We have a motion and a second. No further discussion. All in favor, state aye.
Aye.
Aye. Motion passes. Thank you, Darrell.
Thank you.
Appreciate it. Thank you, everyone. This time, we'll move on to item B of our regular agenda. This is a funding agreement of $223,382 between Douglas County and Ascent Classical Academics. Presenting for staff, Project Manager Tina Dale.
Good afternoon, Commissioners. Tina Dale, representing Community Development. The request before you today is to approve the School Safety and Protection and Mental Health Services funding agreement between Douglas County and Ascent Classical Academies. On May 13th of 2019, the Board of County Commissioners authorized $10 million to improve the physical safety and provide mental health services to Douglas County school children, teachers, and staff. Funding priorities were established, a competitive grant process was developed, and the applications submitted were evaluated. The Board of County Commissioners awarded $223,382 to Ascent Classical Academies through this program. Staff recommends that the Board of County Commissioners approve the funding agreement between Douglas County and the Ascent Classical Academies as it complies with all county standards and procedural guidelines. This concludes my presentation, and I'm here to answer any questions you may have. Thank you.
Tina, was that complete? I'm sorry. I was asking the other commissioners if we're aware anybody from Ascent is in the audience.
I am not. I know Derek Schuler was going to try very hard to be here, and I don't think he was able to make it.
Okay. And I wonder if Mr. Schuler is on the phone.
Commissioner, this is Troy, your host. I have call-in users but cannot identify him.
Okay. I would just assume Mr. Schuler is not on the phone, but thank you for the presentation. Any questions for staff regarding the presentation?
I have none, thank you.
And I have none, thanks.
And I have none. Thank you, Tina. This time, I'll open up for anyone physical audience or the listening audience who would like to address the board regarding item number B on our regular agenda. Seeing no one in the room, and Ms. Dunning, anyone on the phone?
I see no hands raised, Commissioner.
Very well, thank you. At this time, I'll close public comment, bring it back to the board for any further questions, discussions, and/or motion.
You know, it seems like a lifetime ago that we started this endeavor after the shooting at the STEM high school to do something to help our kids stay safe. And this is yet another piece of that puzzle that we're putting together. And I think this just shows that even though this endeavor started over a year ago, government does work slowly, but we've gotten it right. We did a lot of work with this school to make sure that what we were offering would be something that would benefit the students there for a long time. And I just need to thank staff for the patience that they have continued to demonstrate while putting all of this together. And, our hope is that more kids will be safer and healthier when they go to school and then come home. Thank you.
Tina, thank you so much for your ongoing work and commitment to the safety of students in Douglas County. Commissioner Thomas is absolutely correct that this is a high priority, remains a significant endeavor for all of us here. So thank you for your continued work.
And certainly agree, and I know this was brought forward to us about a month ago with a kind of a not a correction, but because of some of the challenges that Cent has been through, it was an asking for an increase on the contract, and I think we had a great discussion. Certainly the packet in your presentation, Tina, gave us a good understanding of that. Appreciate that. This time, we'll entertain a motion.
Mr. Chair, I have a motion to approve a funding agreement of $223,382 between Douglas County and Ascent Classical Academies.
Second.
We have a motion and a second. No further discussion. All in favor, state aye.
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 Aye, the motion passes. Thank you, Tina. Appreciate it. And congratulations to Ascent. Our next item on their agenda is C, is a contract with the Colorado Department of Human Services, Office of Behavioral Health for the Co-Responder Services Grant to fund clinical and other program operating costs for the CRT teams, community response teams, in the amount of $250,000. Presenting for staff, I imagine Barbara Drake, or is Laura Cinconi on the phone? Okay. Presenting for staff is our Mental Health Initiative Coordinator, Laura Cianconi.
Thank you for the introduction. This is Laura Cianconi for staff, addressing agenda item C, contract for co-responder services. This agenda item is a request to renew the county's contract with the Colorado Department of Human Services, Office of Behavioral Health, for another state fiscal year of funding for our co-responder program, the Community Response Teams. And if approved by the board today, the CRT program will receive a total of $250,000 through June 30th, 2021. At this time, I'm happy to address any questions from the board regarding this agenda item. Thank you.
Thank you, Laura. Questions for Laura at this time?
I have no questions. Thank you.
And I have no questions, Mr. Chair. Thank you.
And I have none. This time, I'll open it up for anyone in the audience, either in the room or on the phone, would like to address the board regarding item C on our regular agenda. And Ms. Dunning, do you see any hands raised?
Commissioner, I see no hands raised.
All right, and I see no one coming forward in the room, so we'll close public comment, bring it back to the board for any further comments, questions, and/or motion.
Thank you, Mr. Chair. I think it's just imperative that we continue funding these mental health initiatives that launched in May of 2017 here in Douglas County. We are seeing more and more cases of people having a crisis and not knowing how to take care of themselves. And with our co-responder teams, we now have 4 in the county. A co-responder team is a specially trained clinician along with a specially trained law enforcement officer. And this team goes to cases where people have called needing help. In the past, a lot of those people were taken to jail and charged with disorderly conduct. And they got put on the hamster wheel of the criminal justice system, which didn't help anybody and oftentimes exacerbated the problems. This mental health program is just extraordinary. I've had the opportunity to ride with 2 of these teams, and you can just feel the tension and stress in the room decline as someone who's having a crisis realizes there is someone there who speaks a language that they understand. And it just makes a huge difference, not only to the person who's suffering a mental illness, but the support team around them. And I just think this is an absolutely incredible way to invest dollars because it has a lasting impact immediately and a lasting impact for our citizens. And so I'm very much in support of this. And I'd like to thank staff for the time and effort they spent pursuing these grants. So thank you.
Well, I would like to thank Laura and Barbara Drake, all of staff, and certainly my predecessor commissioners for the incredible work that they've done with regard to mental health. It has really become not just a locally and regionally recognized program, but starting to get some national attention with regard to impacts. Decriminalizing mental health is a top priority of this board, not only because it has a really significant impact for the people involved, but there's also a significant economic advantage when you don't have law enforcement dollars and DA dollars focused toward the prosecution of people that should not be prosecuted to begin with. So I am really thankful for the hard work of staff for so many years on this program, and I'm looking forward to continuing that endeavor to help support mental health services in Douglas County and our region.
Thank you, Commissioners. And I certainly want to compliment Barbara Drake for when she brought this forward to us. I believe it was in 2016. And at that time, it was solely funded by Douglas County. And it is certainly growing to be a cooperation between other municipalities and law enforcement and fire departments within our county. But it's really great to see the partnership going outside of the county and go to the state, because that really shows the significance of the program. No doubt we can give the statistics. We know the results we have seen for individuals who've been challenged mentally. We've seen the results through our emergency departments, through our jail, but to really have a notice given by the state to think we're going to partner with Douglas County on this great program. So Laura, kudos to you and Barbara and the whole staff. It's time to entertain a motion.
Mr. Chair, I will make a motion to approve a contract with the Colorado Department of Human Services Office of Behavioral Health for the Co-Responder Services Grant to fund clinical and other program operating costs for the CRT teams in the amount of $250,000.
Second.
We have a motion and a second. No further discussion. All in favor, state aye.
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 Aye. The motion passes. Congratulations and thank you. Our next item on your agenda, item 4D, intergovernmental agreement between Douglas County and the Tri-County Health Department, TCHD, regarding coronavirus aid, relief, and economic security for regarding the CARES Act. Funding contributed to Tri-County Health for community testing, case investigation, contact tracing, and enhanced data for decision-making. Presenting for staff, Deputy County Manager Barbara Drake.
Thank you, Commissioners, and thank you for your comments on the previous item. Barbara Drake for staff. You have before you an IGA between Douglas County and Tri-County Health, as you said, for community testing, case investigation, contact tracing, and enhanced data collection for decision making. This is based on a May 15th, 2020 action plan that was submitted to us along with our partners under Tri-County Health, Arapahoe and Adams County, as you mentioned, primarily for community testing and contact tracing. The request from Douglas County is for $1,937,696 for these services. 97.5% of this funding is going for staffing costs primarily related to organizing community testing and the contact tracing. It is an up to amount and it will be based on actual reimbursed expenditures from Tri-County for these programs. The three main objectives of this IGA are to expand testing in the 3 Tri-County district counties to nationally recommended targets, to deploy an expanded workforce for contact tracing, and expand capacity to collect and analyze data to inform particularly your decision making. I just will give you a little bit of an update that the daily testing goal right now is 515 tests, or 15 per 10,000 population. And currently Tri-County has 111 contact tracers, case investigators, and they are adding another 50 on August 3rd of this year. So they're ramping up those efforts. If approved today, the funding for this will come from the CARES Act. As you know, we applied to opt into the DOLA funding for CARES Act on June 23rd. We have submitted some additional documents to DOLA, financial documents that they wanted. We have not yet heard officially from them, but everything is looking good. We expect to get a contract from DOLA either sometime this week or next week. And so the funding for this would be exclusively from that CARES Act funding and is contingent upon our receipt of that funding. So Arapahoe and Adams County have already signed similar IGA agreements to the agreement in front of you. And Jennifer Ludwig from Tri-County Health is here if you have any additional questions on the details of their proposal. So I request your approval of this IGA.
Questions for Ms. Drake at this time?
I have none, thank you.
And I have no questions. Thank you, Mr. Chair.
And I do, I either. And Ms. Ludwig, Deputy Director of Tri-County Health, would you like to address the board?
Thank you for the opportunity. I can't see you. We really appreciate the partnership for this contract, for the intergovernmental agreement, to be able to do and increase our workforce, to be able to do contact tracing. As we know, it's something that public health, it is one of our core functions that we do is case investigation. And this is something that we do from an E. coli outbreak to Salmonella, Giardia, and now COVID. This is obviously a bit different just because of the mass scope of contact tracing and the number of people being tested positive on a daily basis, and something that we are unfamiliar with, the coronavirus and how it acts. So this does look a little bit different. There wasn't a database or really a plan for us, so we're creating this as we go. And these funds will help us ramp up our workforce. As Barbara said, we have 111 right now. We have 50 onboarding on Monday. We have planned for another 50 in 2 weeks after that. And we will continue to recruit and onboard people until we are able to keep up with the cases. We, as you are aware, we've had a big surge in cases, and this is across our jurisdiction, not just in Douglas County. So we're covering Adams, Arapahoe, and Douglas, and we've had huge spikes in Adams and Arapahoe. And so our need for doing case investigation has really increased. So we will continue to onboard temporary employees, and we've been working with a third-party contractor to help us with the recruitment, and they are actually the payroll service for that, so that it makes it much easier for us to get people on and off as quickly as we need to. So we've learned a lot through this process. We built the database. And I also want to give a shout out to your GIS services. Joel Hansen has been a great partner for Adam Anderson, who is our population epidemiologist manager, and they've been working together kind of in a consulting colleague capacity in helping us build our Esri database system, which is proving potentially to be a model for other systems across the nation. So Esri is wanting to use it as a template, which is great. Not to say we haven't had issues with it, but once up and running, we are hoping, or not hoping, our goal is to be able to use that database to find trends and identify areas in which we may need to make some policy changes or policy recommendations for reducing exposure, reducing cases. So we are working on that. We're just playing with the data. We've got a team working on that this week. Up to this point, we haven't been able to fully identify, or pinpoint exactly where cases are increasing, but that is what this system will be able to do in contact tracing, what the outcome is. So we really appreciate the support from Douglas County, not just in this contract, but in other ways too, and other human resources and resources that you have and expertise. So appreciate it. Any questions?
Thank you, Ms. Legway. Questions?
I don't have a question, Jennifer, but I would just like to repeat what I said on the phone call this morning, that we got a phone call from a citizen early this morning who's trying to put on an event in Douglas County, and he could not praise you and Melissa enough. And I'd like to echo those sentiments because we have been on weekly phone calls with you. You've been very responsive to email. And I think the public thinks that we are like gladiators against each other. And that's just not really the case, that we are working closely with our health department. And I'd like to thank you for your time because I know how busy you are, but to come down here in person and present to us, it means a lot to us and our citizens, Jennifer. So thank you.
Thank you.
And I will echo those sentiments that no doubt we highly appreciate the hard work of public health professionals, epidemiologists, and certainly the hard work that you, Dr. Douglas, Melissa Sager, have put into this effort for the last 5 months. We realize that nobody signs up to address a global pandemic on a local level, but you have done that very well and have coordinated with us since day one. So we really appreciate the opportunity to continue to work with you in a way that makes the most sense for our citizens, promotes public health, and coordinates so that we can address this. So thank you.
Jennifer, as we talked yesterday, and thank you so much for taking my call and answering questions. You gave a lot of good detail, and I think it may be a couple of things may be important for the public to hear. And you made some very good points of the challenges with contact tracing. And one thing I think really stood out is I asked you, do you think that we've had any particular event or activity here in Douglas County that you've been able to trace to and say that has been a problem area for Douglas County?
We have not been able to. I know, certain events triggered questions to us, like the protests. Have we seen outbreaks related to the protests? And we are now asking our contact tracers, when they call either the initial case or contacts, we ask specifically about, have you been to large events such as protests, so that we might be able to link those. And we've not yet been able to do that, or we have not seen that there are definite causes or linkages. We haven't seen, restaurants are a big place of exposure, or gyms, or even the protests. We have not seen that yet. And that is one of the things that we're testing our database system this week to be able to try to make those connections if they exist. So it's our ability, and that is why we're ramping up our workforce, is to be able to quickly reach out to cases and contacts to be able to start to make those linkages so that we can act quickly, because this is spreading and moving so quickly. The pandemic is moving so quickly. If we're not able to identify those and make rapid decisions, then we're not getting ahead of it. So we are still building and testing. Unfortunately, these things just take time. But I think I'm really impressed with our staff and our staff's ability to ramp up the way we have and build a software system from scratch. But we're working on that, and we're not quite yet to where we're able to make a definitive link to an event or to a particular industry. But our hope is that we're able to do that, not to pick on an industry, but to be able to make policy changes that make sense.
Right, and identify if we do have a problem.
Yep.
So you've done a very good job explaining to us, and I think we all understand the importance of the contact tracing. We've heard from some of the public that, say, what are they going to be doing? What are they going to be asking? So maybe you could touch on what would contact tracing involve and what it wouldn't involve.
Absolutely. So we have on our website, we do have a lot of information about contact tracing for people who might be a little leery of understanding what it is, or if they do get a call from us and don't want to take that. We do have some good information on our website, but really what we are asking is your name, address, confirming that you were a positive case. We'll ask, have you been traveling anywhere? Where did you travel? Did you go to a big event? Did you go to a protest? Just to try to find out where you may have been exposed, or maybe areas in which you may have exposed others. We'll ask who you may have come in contact in the last couple of weeks, and we're looking for close contacts. So we're looking for individuals that you may have been with, that you spent time greater than 15 minutes at less than 6 feet apart. So that's social distancing. So that's considered a close contact. If I go to the grocery store and I end up as a positive case, my contact tracer is not going to put out an announcement and call everybody that was in the grocery store that day. We're looking for that close contact, the opportunity for me to have infected somebody else. And so we'll call those contacts, let them know that they may have been exposed. We'll ask similar questions. So nothing too personal, nothing really invasive. We're not asking for social security numbers. We won't be asking for credit card numbers. We're not asking for citizenship information. And we will not be sharing any of this information. It is all protected under HIPAA. Even phone numbers are protected under HIPAA. So we may take your phone number and use it to call you, but that is the only thing that we're using that phone number. We're not tracking people. We're not using data for mobility purposes. So everything is covered under HIPAA, and our staff are extremely professional, go through a lot of training around personal health information and not to share that information. So while it might be a little bit scary to have the health department call you and ask you a bunch of questions about who you've been with and where you've been, we won't share that with the others. So when we're calling contacts, we won't tell the contact where we got their information from. So we won't identify that, calling somebody that, oh, Jennifer Ludwig said you may be exposed. We won't be saying that. Everything is kept very confidential. But the reason why we ask these questions is to find the links and then to be able to make some changes if need be, if we're finding areas that are problematic.
Wonderful, wonderful explanation. Thank you. And last question, when you presented this budget to us a while back, and maybe just go through the explanation, because it was a budget, what we saw was all 3 counties. And I think it's important to know it's just not Douglas County that you're asking for this. You're asking for all 3 counties as part of Tri-County Health, correct?
Correct. So how we presented our budget to all 3 of our counties, Adams, Arapahoe, and Douglas, is based on the population. So we do it by a per capita amount. And so we had the amount of what we would need to be able to ramp up our workforce to be able to do the case investigations in what we thought would be a worst case scenario of the number of cases coming in per day. And so we built out our workforce based on the number of cases we anticipated being worst case, how many people we would need to be able to handle that many cases, what that would cost us, and then we broke it down by a per capita. So for Douglas County, you are about 23% of our total population we serve 1.5 million people. Douglas County is about 23% of that total population. So that's where we came up with the $1.9 million. For Adams County, they are approximately 35%. The total cost and agreement that we have with Adams County is $2.9 million. and Arapahoe is our largest at 43%, and that is a $3.6 million contract. So our total, and these are all up to amounts based on actuals. So our total anticipated amount for contact tracing between now, well, it actually was started April till the end of the year, is $8.5 million.
Thank you. Appreciate it. Any further questions for Ms. Ludwig? Very good. Thank you. Appreciate it.
Thank you very much. Have a wonderful afternoon.
This time, I'll open it up for anyone in the audience who'd like to address the board, or anyone on the phone who would like to address the board regarding item 4D on our regular agenda.
Commissioner Partridge, I see no hands raised.
Thank you, Ms. Dunning, and no one in the audience. So this time, we'll close public comment and bring it back to the board for any further questions, comments, and discussion in our motion.
So Jennifer, I'd like to thank you again for being here. And this certainly has been a topic of COVID, and there's a lot of confusion in our community. There's people who are concerned. And so I'm just going to take this opportunity to reiterate some information that I got off of the Tri-County Health Department's website last night. So going back to look at the data through June and July for these 2 months, there have been a total of 17 people hospitalized in Douglas County residents hospitalized with COVID. And there have been 7 deaths over the last 2 months from COVID. And Jennifer, I heard you say that there have been spikes across the state, but there have been huge spikes in Adams and Arapahoe. And so while we know that there are more cases, we look at the data and we see that Adams and Arapahoe are a bigger population and they have bigger numbers. I'd also like to address the topic that Adams and Arapahoe have already signed their agreements with Tri-County Health. And I believe the reason for that is they are populations over 500,000. So as counties, they receive direct funding for the CARES money from the federal government. Adams County received 90 million, Arapahoe County received 114 million. So they already have that cash in hand, and they have been able to sign agreements with Tri-County Health for these extra services. Douglas County has less than 500,000 population, so we did not receive direct funding from the federal government. We are working through the Department of Local Affairs, DOLA. We have filled out paperwork. We have done everything we can. It looks like we can qualify to up to $30.1 million. So we're doing everything we can. And once we access that money, we will be able to fund this contract. But I just want to make it clear to our citizens that we weren't dragging our feet and not wanting to participate. The money was doled out in a different fashion for Douglas County than Adams and Arapahoe County. And that's the only reason we didn't have this contract done sooner. So we are being very responsive to the request from Tri-County Health. We are just having to manage the money differently because we have not received it yet. So I am in favor of this. We certainly don't want anything to get out of control. And we do continually ask our citizens to use personal responsibility and make good decisions for themselves and their families. Thank you for the opportunity to make some comments.
You know, Douglas County is the healthiest county in the country, according to U.S. News and World Report. And Commissioner Thomas is correct that our numbers since the beginning of the COVID pandemic have been markedly different than the other counties involved in Tri-County Health. And we've had an ongoing conversation with regard to autonomy and local governance that we're excited to continue with the principles at Tri-County Health, because I think it makes the most sense for our citizens. But that said, actions speak the loudest, as we demonstrate, hopefully, with today's decision, that the continuity of public health services delivery to our citizens and the business community is firmly in place with Tri-County Health as we work collaboratively to contain transmission of COVID-19 and maintain other public health services. Thank you, Mr. Chair.
Thank you, Commissioners. And I think I would just like to stress, agreeing with my commissioners on their comments too, I'd like to stress the importance that we've seen with the case investigation and contact tracing. And I really believe that it happens a lot already. So we certainly ask for patience with individuals when they're asked for provide information, because it all is the purpose of protecting the health of themselves, those around, and everyone in here within our county and state. And, I had a question myself. My wife and I got tested, and when I was under a few symptoms, I was contacting individuals that I'd been in and around that day, and just to let them know, because it all could be part of the process. And so I did that for, if I did test positive, I was that one more step ahead for Tri-County to be able to case investigate. So it is important. I certainly believe putting these funds forward is a wise idea for us. So thank you, Barbara Drake, for bringing this forward. Thank you, Jennifer Ludwig, Tri-County Health. You've done a wonderful job, and we really appreciate you. This time, no further comments. I'll entertain a motion.
Mr. Chair, I'll make a motion to approve an intergovernmental agreement between Douglas County and the Tri-County Health Department regarding coronavirus aid, relief, and Economic Security Act funding contribution to Tri-County Health Department for community testing, case investigation, contact tracing, and enhanced data for decision-making.
Second.
We have a motion and a second. No further discussion. All in favor, state aye.
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 Aye. The motion passes. Congratulations. Thank you. Appreciate it.
Thank you.
Our next item on the agenda, 4E, is a public contract for services between Douglas County Commissioners and Stride Community Health Center. Presenting for staff is Special Project Manager Holly Carroll.
Good afternoon, Commissioners. Holly Carroll from Administration. The agenda item presented to you for your consideration today is a service contract between Douglas County and Stride Community Health Center for the provision of COVID-19 testing this fall. This contract is for $1,032,388.23 and is an expense deemed eligible for reimbursement through the CARES Act, of which Douglas County's allocation is expected to total $30.1 million. This funding benefits the county as a whole, and conversations with representatives from the municipalities in Douglas County resulted in prioritizing supplemental community testing beyond that which is already being provided by local healthcare clinics, urgent cares, and hospitals. Who is Stride? Tri-County Health was crucial in introducing us to this organization, so they came well recommended. They're a longstanding, reputable healthcare provider in the metro area for over 30 years. They've operated 18 clinics providing a wide variety of health services until this year, when they consolidated to meet the community's needs, more efficiently provide testing, and to preserve PPE. Stride's service area covers these 5 counties, and they have been providing community COVID-19 testing services since early March. They currently have a contract with Arapahoe County for $2.5 million, and they're expanding their testing in Jefferson County, where they have already had a presence. Some of the details of this proposed contract with Stride include that there will never be a cost assessed to participants. They offer a diverse portfolio of testing options, such as the traditional swab diagnostic test and antibody testing, and have recently added rapid COVID testing, which will be available to produce results on site in approximately 15 minutes. They will be offering these services by way of a mobile unit, which will allow them to reach a wide variety of populations, including those in high risk and high priority populations, such as individuals living in congregate settings or needing admittance for programs such as our winter shelter network. And they will bill us monthly for actual services rendered and supplies used at that time. This contract provides Douglas County and the municipalities with a flexible, dedicated team who can be deployed for community testing anywhere from neighborhoods in the foothills to city centers, or as a strike team in the case of an outbreak or other immediate need. These are just a few of the fantastic staff from Stride who have provided support in the development of this contract to serve Douglas County citizens, and I'm very excited to work with them should this contract be approved. This concludes my presentation at this time. Also in attendance on the phone is Dennis Wilkin and Marianne Schultz from Stride, as well as Wendy Nading from Tri-County Health Department. And in the audience is Jennifer Ludwig from Tri-County Health, if you should have any questions. Thank you.
Thank you, Holly. Questions for staff at this time?
I don't have any questions. Thank you, Holly.
And I don't have any questions.
And I either. And Holly, do you know if anyone that you mentioned off would like to address the board?
I do not.
Okay, and I'll ask Ms. Ludwig if she'd like to address the board. You don't have to feel obligated, but feel free to. Okay, shaking the head no. And I will ask if there is anyone on the phone who would like to address the board. Please raise your hand, and Mrs. Dunning will connect you.
Commissioner Partridge, this is Troy for staff. I see no hands raised.
Very well, thank you. Thank you. This time, I'll open it up for anyone in the audience, either physically or on the phone, who would like to address the board regarding item 4E on our regular agenda.
No hands raised virtually, Commissioner Partridge.
Thank you, Ms. Dunning. And Ms. Ludwig, would you like to?
I haven't read the contract and wasn't prepared to speak to this, but M can say wonderful things about Stride and the opportunity to bring them into Douglas County to do the testing. They really have been a phenomenal partner over many years in working with us with co-location, and I think they've really stepped up to the testing plate and have done a lot in at least the jurisdiction that we serve and others. So I speak very highly of Stride and their partnership and their due diligence and what they've been doing and the communities that they serve. So just putting in a plug for the great work of Stride and think they would be a great partner for the county. So that's all I wanted to say.
Thank you. And seeing no one else this time, I will close public comment. Bring it back to the board for any further questions, comments, and or discussion or motion.
Mr. Chair, I just wanted to add as a point of discussion a tremendous level of thanks to Holly Carroll and really all of staff. But Holly has just done a fantastic job with regard to all things testing. And I think consistent with some of our earlier comments about what we do in Douglas County, good just isn't good enough. And so, Holly, you really demonstrated excellence throughout these last 5 months. You always demonstrate excellence, but I think these last 5 months in particular. So a tremendous thanks to you, and it's an honor to partner with Stride in this endeavor. And with that, Mr. Chair, I will make a motion to approve a public contract for services between Douglas County Commissioners and Stride Community Health Center.
Second.
We have a motion and a second, and I will just comment that I think this shows the commitment that we in Douglas County are putting forth to contain the COVID epidemic, and then with the cooperation with Tri-County Health and all our other hospital partners and all the other testing partners, we really take this seriously because it is something we would like to speak on. I think we all would like to get back to is what we consider normal, and I think this is a way that we can do that. So thank you for bringing this forward. So we have a motion and a second. No further discussion. All in favor, state aye.
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 Aye. The motion passes. Thank you, Holly. Thank you, Ms. Ludwig, again. And Mr. DeBoard, any further business?
No further business.
And the county manager report was enclosed in our packet. Commissioner comments.
Commissioner Partridge, I do have a comment. I always like reading the county manager reports because there's just such great information in there. We know that 47% of Douglas County is open space, and our citizens love to utilize that open space. And hidden in the county manager report is a new program that is the Trail Ambassador Program, and the tagline is Tap into DC TAP. So if you think Trail Advisory Program is TAP, and this will be a group of volunteers. This will roll out in the fall, and they will be doing things like talking about the principles of trail etiquette and leave no trace, trailhead parking lot hosts for the activities to make sure people are maximizing those parking areas, nature and history information, open space rules, regulations, and finally, visitor interactions along the trail system. So this is another opportunity for citizens to reach out and volunteer for the county in some area that they have a particular interest. So if you like being involved with the open space program and you like hiking on our trails, be watching for future requests for people to sign into the DC TAP program. Thank you.
And I do have one comment, Mr. Chair. You know, we did receive on July 7th, 2020, a report from emergency management staff with regard to the Chat Ridge 2 fire. And I'm looking forward to an opportunity for this board to publicly recognize emergency management staff. But before it goes too long, I certainly wanted to thank every member of fire, law enforcement, and emergency management for ensuring that there was no property damage and no loss of life during that fire. Truly a tremendous effort, and we greatly appreciate them.
Very well. And my fellow commissioners are not kicking me under the table to remind me of this. I did remember to state this year. So first of all, just some sad news is that we were to have a concert this Saturday evening, August 1st, at the county fair and rodeo. It would have been Charlie Daniels, who, two reasons. Fortunately, we were not able to have that number of people to attend a concert, but the biggest unfortunate thing is the passing away of Charlie Daniels a few weeks ago. But we'll say his legend lives on. Another thing to report is kind of follow up to Commissioner Layton's comments. If you have not heard, the Sheriff's Office has removed us from stage 2 fire restrictions down to stage 1 fire restrictions. And on the county website, you can find what is allowed under stage 1 or what is not allowed. So with that, along with that, I will mention that we will have a fireworks display, and actually it'll be Castle Rock that will be shooting off the display on the west side of town at their quarry. That'll be Saturday evening. So that'll be in conjunction with the Douglas County Fair and Rodeo, which in a way is about halfway over. We've had many of the FFA and 4-H animal species and projects completed. They're in process now, but because of COVID, we've had to make some changes. The Fair Board has done a wonderful job putting on the fair this year. Thursday night will be the PBR, Professional Bull Riding Rodeo, the outdoor arena. Tickets are still available. You have to have a ticket, and you can get those online. Friday night will be the annual 4-H livestock auction. That'll be in the indoor arena at the fair, and that is for the opportunity for the kids to show their species and to actually put their animals up for auction. Saturday night will be the first of 2 rodeos, and that'll be the PRCA rodeo. And we really have to tell everybody that if you haven't got your ticket, you might want to get it now because it's going to be an exciting event. We have heard from the contestants who have had limited rodeos to attend this year that we're going to have some world-class rodeo. We usually do, but world-class rodeo contestants. So maybe somebody can ride that bull for more than 8 seconds. We'll see. And of course, then the final rodeo will be on Sunday afternoon. So hope everybody gets to enjoy it. It is not the same fair as our county manager coined it so well. It's kind of a throwback fair, more back to just the traditional, what we know as a fair and rodeo. So hope everybody gets a chance to attend it, and hope everybody stays well and is blessed. Thank you. We are adjourned. For anyone still in the line,